May I have your attention, please? Good afternoon, everyone. Good afternoon, everyone. Thank you for coming to our conference committee meeting on House Bill 1725, which is our effort to provide health insurance for our low-income, hardworking Mississippians. I think we had a really good discussion 2 days ago that started the conversation between the Senate plan and the House plan, and I really felt like we made some good progress, and that was a good conversation that we had on that day. I was hoping that we would be able to resume that today. We realize that we have, the days are winding down, as we all know and are probably grateful for. But we know that we only have a few short days left, also with the time constraints with regard to filing bills and in the appropriate time before sine die, the time is drawing near. So I was hoping that we would have that opportunity, but as you can see and as I can see, apparently the Senate conferees are not going to be able to make it today. So I'm disappointed in that. We know that this is a historic piece of legislation, possibly one of the biggest legislative priorities of the session. Both the leadership on both sides of this Capitol have said that this is a priority for them. So I'm hopeful that we will have more information to agree on a bill that we can present to the governor, and so I guess we'll just wait and see when we can resume that conversation. Again, hoping it was going to be today, but I can't. That's all I can say.
If you don't mind, Madam Chairman, I would like to say for the past 3 months or 3.5 months, Chairwoman McGee has been working extremely hard on this Medicaid expansion, whether it's been in a Ferrari or whether it's in a Prius. But Mississippi has been waiting a long time for this moment, and we're getting close. So it's disappointing that we're not continuing the conversations today, but I do want to say that over that past 3 months, while Medicaid's been going on in public health, we have been entertaining several people, many of whom are in this room, who come in and tell us how unhealthy Mississippi is, who come in and tell us how we don't have enough people to man the clinics or the hospitals. And then we have the hospital saying we're losing money every day. We can't sustain our hospitals in the Delta. And they're under a mandate to take care of these people. And here we have, whether we did not create this opportunity, it came to us from the federal government. And here we are, a chance to receive 90 cents on the dollar if we give 10 cents. And that's it. And I don't know of a business that would not take that, and yet we're going to turn that down. In the House side, we're not willing to turn that down. We want to help. And here's an opportunity to help all these people that have been in the Capitol over the past 3 months asking for help. The House of Representatives is listening.
Thank you very much. Thank you, Madam Chair. I was looking forward today to discussing the numbers. I think the Chair Lady has turned our numbers over and had a good independent analysis. I asked some questions a couple of days ago about the exchange and where they got their numbers from, and I think the stakeholders and the taxpayers of the state of Mississippi want to know where they're getting their numbers for, because we would like to look at those as well, and we're here to try to reach an agreement on a big issue for the future of Mississippi and health care for all. And so I think it's important that we have where those numbers come from. And I also think that it's important that we have this type of meeting here because it's such a big issue. And I know there's been a lot of campaigns across the state when people campaign about things, about, running the state like a business and transparency. But here we are today with a great opportunity for some transparency and to run this state like a business. And I just don't think not showing up to a meeting is how you run a state or how you run a business.
So for those of you who are here looking for information, so are we. Just know that the House stands ready to continue to negotiate this very important issue, and we will we are here at the Capitol, and we are hoping that we will be able to have some conversations later today and in the final days of the session. So thank y'all for coming. Sorry to have wasted your time today. Thank you very much.